The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody, and welcome to the Chronic Disease Prevention and Health Promotion webinar series. My name is Kelly Cheetah, and I'll be facilitating the talk today. Before we get started, there are just a few housekeeping items I wanted to go over. The presentation will start, the presentation itself is about 20 minutes long, and there's 10 minutes at the end for open discussion. And I just want to remind everybody the real purpose for these webinar series presentations is for us to find ways to present our work and then find ways to collaborate and work better together as public health professionals and partners in different areas. So we'll be thinking about that as we go through the presentation and be ready to talk about it at the end. A couple of technical pieces. One second here, sorry. The audio for this webinar should be coming through your computer or through the telephone line number that you were provided. If you have technical difficulties during the webinar, let us know by using the question panel in your sidebar. You should have a section that looks like this on your sidebar, and that's where you type questions in, and I'll try to respond to them as quickly as I can. You will need a microphone on your computer, or you'll need to use the telephone number provided to ask a question out loud. Please hold all the questions until the end of the presentation, and then we'll be able to discuss this at length. To join the conversation or to ask a question, raise your hand. And again, we've got a picture up here in your sidebar. You should have a yellow hand where you can press on. When that's raised, we'll start answering questions in the order that they're asked. With that, I will leave it up to David to introduce himself and the topic for today.
Thank you very much, Kelly. Well, today I'm going to be talking about a cancer study that I did for the Alaska Native community of Yakutat, located on the top of the southeast panhandle of the state. You can see where that little star is on the map of the first slide. Oh, just as a way of introduction, I'm the data analyst for the Alaska Cancer Registry, and I've been in that position for the last 16 years. Okay. So some background on the study first. Near Yakutat is the Ankau salt chucks of the Phipps Peninsula. It is an estuary that has been traditionally used as a source of subsistence food for the Yakutat community. A culture camp for children operated there during the summers until 2003. The area was also used as a U.S. military site during World War II and by several federal government agencies through the 1970s. Several military dump sites were also located there. The community has expressed concerns about apparent elevated rates of illnesses, including cancer, and that such illnesses may be caused by waste left behind from the former military installations on the peninsula. This resulted in a change in traditional harvest locations and closure of the culture camp. The cancer study resulted in 3 reports. For the first report, we looked at the number of observed versus expected number of cancer cases. And the second report, we looked at the observed number versus expected number of cancer deaths. And for these 2 reports, we wanted to know, are the number of observed cancers greater than the number of expected cancers? And if they are, is the difference between the observed and expected statistically significant? And for the third report, we looked at the number and types of cancer cases and cancer deaths. And for this report, we wanted to know, are the number of cancers per year increasing? Are people dying at younger ages over time? Are there a lot of rare cancers, or are the most numerous cancers the same as the top-ranked cancers in the state? Before I get into the Yakutat cancer study, I want to talk a little bit about cancer. Cancer is not one disease, but a family of diseases in which abnormal cells grow uncontrollably and invade other parts of the body through the blood and lymph systems. Unfortunately, cancer is more common than most people realize. About half of all men and a third of all women will develop some sort of cancer during their lifetime. and about a quarter of all deaths nationwide are from cancer. I'd also like to talk a little bit about cancer rates and statistics in general. Cancer rates are essentially the number of cancer cases divided by the total number of people in a population. This number is a very small fraction, so we usually express cancer rates as a number multiplied by 100,000. For example, the cancer incidence rate for the entire state of Alaska over the 5-year period of 2007 through 2011 is 459 per 100,000 persons. So this means that in any random group of 100,000 people in Alaska, about 459 of them are likely to become diagnosed with cancer within the next year. Now, since people are not machines, there will be some variability in this statistic. It might be slightly higher or slightly lower, and we can calculate what this range is most likely going to be, and we call this expected range a confidence interval. So in the first report, we looked at the observed versus expected number of cancer cases. And in the report, first we determine the number of reported cancer cases for the community of Yakutat, and then we calculate the number of expected cancers. And we ask, is the observed greater than the expected? And if so, is this difference statistically significant? To find the reported cancer cases, the number of reported cancer cases, I went to the Alaska Cancer Registry database. It contains information about all cancer patients in the state starting in 1996 who were reported by their healthcare providers. These providers include hospitals, physicians, and pathology laboratories. This cancer reporting is required by federal and state law throughout the United States. We also exchange data with other state cancer registries around the country, and in this way, we discover patients who chose diagnosis or treatment in another state. CDC reviews our data annually for quality and completeness, so we know that our data are of high quality and are at least 95% complete or higher. According to the information in the Alaska Cancer Registry, the total number of cancer cases from Yakutat from 1996 to 2011 is 44. Now that we know the number of observed cancer cases in Yakutat, we need to calculate the number of cancer cases that we would expect to see over the same time period. To do this, we need to know the cancer rate for the entire state of Alaska and the population of Yakutat. So if the population demographics, so if the age distribution and the race distribution of the population was identical in every town and every village in Alaska, then this calculation would be really, really easy. Because all we'd have to do is this formula on the slide here, which is the cancer incidence rate for Alaska per 100,000 people equals the expected number of cases divided by the community population. But unfortunately, it's not this easy. We need to account for the difference in age distribution between the state and the community. So we go to the US Census website and obtain population information by age group for the community of Yakutat. And then we do that calculation that you just saw on the previous slide for each of those age groups. And that's what you see on this slide here. We have a table of 18 different age categories, and then the cancer rate for each of those age categories. And then the next column is the population of Yakutat from the year 2000 US Census for each of those age categories. And then when you do that calculation from the previous slide, you get an expected number of cases expressed as a fraction of a person. So then we add each age group up to get an expected number of cases per year. And in this case, it's a little over 2 cases per year. So we also need to account for changes in the population over time. So first, we do this calculation using the population data from the 2000 year 2000 U.S. Census for a 10-year range of data from 1996 through 2005. So for this table, we take the expected number of cases per year, which is a little over 2, and then multiply it by 10 for this 10-year time period. And so that's on the bottom of this table here. So we've got about 22 cases expected over a 10-year time period. Then we do the same calculation again using the population data from the 2010 U.S. Census for all data starting with 2006 for the 6 years of data that we have. And that's what you see on this table. So we do the same calculations that you just saw on the previous table, and we get a expected number of cases per year, which is about 3, and then we multiply that by 6 years to get about 18 cases over that time period. Then we add the results together for the 10-year time period and the 6-year time period to get a total number of expected cases over the entire 16-year time period, which in this case is about 41. But this calculation assumes that proportion of race groups in Yakutat is the same as Alaska statewide, which it's not. And this is important because each race group has different top-ranked cancers. So we have to expand the two tables that you just saw for 4 different race groups of Alaska Native, White, Black, and Asian and Pacific Islanders. And then when you do that, you get a table that looks like this. And I'm not really expecting you to read this thing, but just wanted to point out that the first the first 4 columns is essentially the same table that you saw previously. But this time it's repeated 4 different times for each of the races for White, Black, Alaska Native, and Asian Pacific Islanders. And then you do the same math that you saw on the previous table for this one. And you add everything up, and you get a number of expected cases per year, then multiply it by the 10-year time period. And this is just for the first time period for 1996 to 2005. And then we need to do it all over again for the next time period, which looks like this. So when I add up the expected number of cases over the entire 16-year time period of 1996 to 2011, I came up with 44 cases. So the observed number of cancer cases is 44, and the expected number of cases is also 44. Well, 43.6 actually, but I rounded this up to 44, so we don't have to talk about a fraction of a person. But someone might say that if you use this decimal number, then there are actually more observed cancer cases than expected. It's a very small difference between the two numbers, less than a person. But is this difference statistically significant? Now, like I said before, people are not machines, so there is some expected variability in the data. So I did a statistical test called the standard incidence ratio. We use the standard incidence ratio test when the number of observed cases is greater than the number of expected cases. So this ratio is essentially just the number of observed cases divided by the number of expected cases, and then we just multiply it by 100 to make it a little larger. Then we calculate the upper and lower confidence intervals of this ratio. If the confidence interval does not include the number 100, then the number of observed cases is statistically significantly different than the number of expected cases. So here's a summary of the data, and the bottom table here, we have the standard incidence ratio was calculated to be 100.9. That's almost exactly 100, which was, since the number of observed, number of expected are almost identical. And then you have the upper and lower confidence interval. And you can see that the confidence interval does indeed include the number 100. So even though there are slightly more observed cases than the expected number of cases, this difference is not statistically significant. Now we look at the second report. It's just like the first report, but instead of looking at cancer incidence cases, we're looking at cancer deaths. First, we determine the number of reported cancer deaths for the community of Yakutat. Then we calculate the number of expected cancer deaths. Then we ask, is the observed greater than expected? And if so, is this difference statistically significant? To find the number of reported cancer deaths, I went to the Alaska Bureau of Vital Statistics Mortality database. It contains information about all deaths in Alaska that were recorded on death certificates. Now, the important thing to remember for this type of study is that there is a difference between dying of cancer and dying with cancer. Someone could have cancer but died of a stroke or in a car accident. So in this situation, their cause of death would not be cancer. The healthcare provider who fills out the death certificate determines what the primary cause of death is, and that is what goes on into the database. So according to the state mortality database, the total number of cancer deaths from Yakutat from 1996 to 2012 is 19. Now that we know the number of observed cancer deaths in Yakutat, we need to calculate the number of cancer deaths that we would expect to see over the same time period. And to do this, we need to know the cancer death rate for the entire state of Alaska and the population of Yakutat. So I'm going to spare you all the math that you saw from the first report and skip to the results. The observed number of cancer deaths is 19, and the expected number of cancer deaths is 16, a difference of 3 cases. I did the same type of statistical test that I did last time, but here it's called the standard mortality ratio instead of the standard incidence ratio. And you can see from the bottom table that the standard mortality ratio is about 115, and there's a lower and an upper confidence interval that has been calculated. And you can see that even though there are slightly more observed deaths than the expected number of deaths, this difference is not statistically significant because the upper and lower confidence interval does include the value of 100. The third report looks at the number and types of cancers in Yakutat. I used the Alaska Cancer Registry for the source for the reported cancer cases, and the Bureau of Vital Statistics State Mortality Database for the source for the reported cancer deaths. And looked at the number of cancers per year, and then compared Yakutat cancers to the top-ranked statewide cancers. So I looked at the number and types of cancer cases diagnosed in Yakutat since 1996. There were 44 cases, an average of about 3 new cases of cancer per year. Some years have more, and some years have less, but the change from year to year appears to be random. The top 4 most common cancers are lung, colorectal, prostate, and female breast. There are 23 of these cases, or about 52% of the total. If you look at these 4 cancers and compare them to the most common cancers statewide since 1996, they correspond to the 4 most common cancers. And in both Yakutat and Alaska Native statewide, the most common cancers are lung and colorectal. I then looked at the number and types of cancer deaths reported in Yakutat since 1996. There were 19 cancer deaths, an average of about 1 death per year. Some years have more and some years have less. Some years don't have any. But the change from year to year appears to be random. Of the 19 cancer deaths, there are 3 types of cancer that have more than 1 occurrence, for a total of 11 cases, or 58% of the total. They are lung, prostate, and leukemia. Lung by far has the most occurrences with 7 cases, or 37% of the total. Statewide, lung cancer represents 29% of all cancer deaths, and is the most common type of cancer death. The 2 prostate and 2 leukemia deaths were patients who were white and are fairly common for this race. So after conducting this review, we can conclude that the number and types of cancer cases and cancer deaths occurring in Yakutat do not appear to be unusual. We don't see, for example, the number of cancer cases increasing with time. Their distribution appears to be random, and we don't see a large number of rare cancers. So after the reports were drafted, we sent them to Joe Sarcone of ATSDR, which is the U.S. Agency for Toxic Substances and Disease Registry. He was the person who initially brought this cancer concern to us, and we had been working closely with him on this project. He then passed the reports on to the Yakutat Tlingit tribe leaders. They set up an open community meeting in August of 2014 so we could present the study findings via teleconference. And Joe was present in Yakutat and served as the meeting moderator. The community members were able to ask us questions after our presentation. The community had a very positive reception to the study results. As a result of the study findings, the tribal leaders of the Yakutat Tlingit tribe decided to change their focus from searching for why people in their community have cancer to screening and early detection of cancer in their community. They contacted SEARCH, which is the Southeast Alaska Regional Health Consortium, which is an Alaska Native-run health organization that serves Southeast Alaska, to check on the availability of screening technology for Yakutat. Unfortunately, the mobile mammography unit at the nearby Bartlett Regional Hospital in Juneau was no longer functional. Instead, SEARCH arranged for and funded the transportation of a mobile mammography unit from the Breast Cancer Detection Center in Fairbanks and was transported by vehicle and ferry about 500 miles away. So when they brought the unit to Yakutat, 41 women received mammograms in May of 2015. Now, this may not seem like a large number of screenings to some of you who live in large towns, but the population of Yakutat is only about 650 people. The number of women over 40 years old is about 150 people. So over a quarter of the entire target population was screened in 1 month, which is a remarkable achievement. The Yakutat Tlingit tribe leaders also asked us to present the study at 2 Anchorage conferences with them, with an additional study that was done on dioxin contamination that was conducted by the state's section of epidemiology. Joe Sarcone from ATSDR moderated the session at both of these conferences. In closing, I just wanted to say that communities are not always this receptive to our findings. Environmental contamination can stir up a lot of emotions, and there seems to be a lot of controversy in this area. For this, and maybe other reasons, we have had communities disagree with our conclusion that the causes of cancer in their community members were most likely not from environmental exposures. Fortunately, in the case of Yakutat, the result was the best possible outcome from a public health perspective. And finally, I'd like to thank CDC for their continued funding of the Alaska Cancer Registry, which made this study possible. Thank you. And then finally, we have my contact information if anybody would like to contact me in the future.
Thank you, everyone, for attending. So now we have some time for open discussion, questions, if people have questions, or any ideas on how we could collaborate or how this impacts the work that you're all doing out there. So I don't see any hands raised at this moment for questions, and I don't have any written in. I'll give you another chance to ask questions. Again, raise your hand with the little icon that you can ask questions with if you have a question or you want to say something. All right, no questions. We can try something new here. I'm going to unmute everybody, and we're going to see if anybody has questions. If not, that'll be the end of it. And I'm going to warn you all that if you have a mic on your computer, you're going to we'll be able to hear you. Any questions out there? I'm still working on unmuting everybody. And And you can mute yourself if you want to.
Hi, this is Karen Pletnikoff.
Hi.
I just wanted some clarification that in the records that get into the registry to denote where somebody's from when they die, I imagine many people don't die at home if they are ailing with cancer. They might be in Anchorage or maybe even in the lower 48. So is there something that accounts for their hometown versus where they actually physically died?
Yes, I can answer that. On the official state death certificate, there is a place to record the person's residence, the place, or their town of residence, and also the town where they died. So those are two separate items on the death certificate. And so for this study, we used their place of residence and not where they died.
Thank you. I also wondered if there were any, I know that the top 4 cancers found in this study were the same as the top 4 cancers found in Alaska Native populations and Alaska as a whole, but were any of the other cancers, the less common ones, associated with known types of contaminants of concern, like dioxins, for instance, or were they, like there were no other statistical anomalies with those different cancers?
That's correct. There was, we did look at the other cancers that occurred, and there was nothing unusual. There wasn't a large number of rare cancers, for example, or a large number of something that you would not expect to see in the population.
Did that answer your question, Karen?
It did. Thank you.
Yeah. Okay. It looks like Sean Johnson has a question. Sean, you typed one in also, but I'll give you a chance of talking if you want to. All right, I'll read Sean's question. She put a very interesting presentation. The newspaper recently highlighted toxic substances left by the military on St. Lawrence Island. Is there any thought in doing a similar study on data there if the community, Savunga and Gamble are interested?
We actually were approached by the communities of Savunga and Gamble through Joe Sarcone about a year ago, and we did actually do a study very similar to this for those communities, and the results were essentially the same. We did not find anything unusual as far as the number of cancer cases that occurred in Gamble and Savunga.
And then we have a question from Hope Miller. Hope, are you able to talk online, or if not, I'll read your question. I'll give you a chance to speak. Okay, so hello, my name is Hope Miller, and I'm with KTVA in Anchorage. I'm curious about how common these mobile mammography units are in Alaska.
That I do not know.
I will forward your question to our comprehensive cancer and control person. That they can get back to you on that one, Hope. Thank you for your question. Any other questions out there?
I just wanted to say thank you guys for this, and whenever it's contaminants in traditional foods or any time when people are exposed from somebody else's activities, it really does take a lot of thoughtful education and outreach to put these kinds of numbers in the proper context and to it's more than just convincing people that this thing is not a problem. It's that interaction where we actually can find a way to address what the problem is, which is people dying of cancer, however they get it. So I wanted to say thank you guys for your good work.
Thank you, Karen.
Yeah,
Thank you very
thank you.
much. Seeing no other questions, I think we'll end the conversation for today. Thank you very much. Oh, and one last final pitch for 1 month from today, we'll have another one of these. These occur every third Tuesday of the month, and the next session is going to be partnering with providers to increase screening rates. So if that's of interest to you, watch for the announcement and sign up for it. Thank you again.